Okay, good evening. My name is Paul Formica. I welcome you to the East Lyme Town Hall on behalf of the Park and Rec Department, Dave Putnam, our wonderful Park and Rec Director, and the Brian T. Dagle Memorial Foundation, Paul and Ann Dagle. We invite you here this evening to share in what we hope is a discussion of a topic that needs to, in my view, come out of the shadows a little bit and be talked about so that we can work on awareness, not only of the suicide problem that we have, but also prevention. We have many of you in the audience are here that work in and around this issue, either with students or professional organizations, and I want to welcome a conversation during the evening. We have three wonderful speakers. Mike is the technical director for the video, and what I'm hoping to do is to have and generate a conversation. They'll each spend a few minutes talking about what it is they'd like to talk about, and then we'll open it up. Now, I will tell you that we are going live on this Channel 22 cable network that we have, and we're also taping this. So we'll be playing this later on because we think it's an important topic. If you would like to speak, and I hope you would, to capture what you say, I'd appreciate you going to the podium and just kind of speaking into the microphone if you feel comfortable. If you don't, it just will be an item that won't be included on the tape. So it was 1980. I had just moved here and met my wife-to-be. We began dating, and I had not met any of the family until a dark night in the middle of the summer when we got a call that we had to go to Bacchus. And that night, because of Donna's brother's suicide, I was able to meet my in-laws to be. And that was my first real experience with this event. And I understand that the family connection, as it makes its way throughout the entire family, just permeates everything you think about and everything you do. So when the opportunity came up to do this, I just felt it was an important conversation that the community needed to have. And I welcome the strength of all of the rest of people to be able to share that, because it's a hard thing to do. So I'd like to again thank you for coming. Our first speaker, Andrea Duarte? Duarte? Mm-hmm. Okay. Is a licensed clinical social worker who received her master's degree in social work and public health from the University of Connecticut and has over 20 years experience in the substance abuse prevention and mental health promotion field. Ms. Duarte is a behavioral health program manager in the Prevention and Health Promotion Division of the Connecticut Department of Mental Health and Addiction Services, where she oversees federal and state community-based behavioral health prevention and health promotion initiatives and contracts, and is the Employee Assistance Program Liaison to the Commissioner's Office. She is also a member of many statewide committees and serves as the co-chair for the Connecticut Suicide Advisory Board. So, thank you.
Hello, everybody. Thank you so much for the invitation to be here tonight. And I'm honored to be part of this community conversation. I don't get out very often in the evenings anymore. I have little kids. So what I'd like to actually start with, and maybe a little less formal and kind of bring a little levity to this, is we've been working with the Suicide Advisory Board and our state partners to really get this conversation started at the community level, bridging the state and community discussions and efforts. And one of the things that we did this year is to start a new conversation with engaging communities through a whiteboard public campaign. We asked people to take these boards back to their communities and their campuses and to tell us how they would start the conversation around suicide prevention and mental health promotion. So this is the result. This is a 1-minute PSA, and I'd like to share it with you first to kind of just kick off the piece that I'm going to cover this morning, or this evening, sorry.
All right, just as a side note, I usually have a wonderful technical assistant that helps me with this TV thing, but he has SAT classes this evening, so What I want to do is focus the camera in on the screen, so we'll follow along here and there. So you'll just bear with me while I do that. That's where it's coming from, right, Andrea?
Yes.
And then the folks at home. And then what we could do, if that's comfortable for you, I think that might be more visible for the folks out there. Can you do that here for this time? And I'll flip it on and off if you like.
Sure. Thank you. So I don't know if you'd like to welcome some responses at this point, or you want to engage the audience, or if you'd like me to start. It's up to you.
What does the audience think about what we want to do? Do you want to just kind of weigh in when you feel like weighing in? You can raise your hand and just say, any response to that or or do you want to just, we'll start and we'll move along? We'll start and move along. Okay, good. Thank you.
Okay, so what I wanted to just share with you is we had received over, I think it was 55 submissions for that campaign, and we really had to focus on, we could only put so many into the PSA, so we really tried to get a diverse age representation and race representation and messaging, and so we worked really hard, a couple of us from the Suicide Advisory Board, to put that together, and we've been sharing that with communities and encouraging our regional suicide prevention coordinators to get that out. So I don't know if some of you may have seen this before. So what I'd like to do is kind of get through a little bit of the dry part of the conversation, giving you a little bit of background on suicide and also suicide prevention in our state. We actually have a pretty long history of suicide prevention in our state. Not all states do. So if we could just advance. Actually, I'll take a look at that. Thanks. So I'm going to go over these different items very quickly, just to get through some things. And then we can have a little bit of a conversation afterwards. So these are probably 3 of the most common myths about suicide. That it's a normal reaction to extreme stress, that asking the question will actually encourage someone to act on suicidal thoughts, and that if someone talks about it, that they won't do anything in terms of making attempts or dying by suicide. So it's really important that people understand that it's never just one thing. I mean, we talk about warning signs and risk factors, and I'll mention those in a little bit, but that it's usually a combination of different things that influence someone to consider suicide and take action. And that talking about it does not make it happen, as with many other public health issues. Just talking about it doesn't make it happen. And it's important to be able to have open communication about suicide and mental health issues, as well as other health issues. And that if people are talking about it, it's usually a way for them to ask for help. And these days, you see it in social media. People may not speak about it, but they might write about it. So I would encourage you to respond if you do see someone talking about it, that you take it seriously. That's one of the biggest questions I get, most common questions I get. I'll get emails from all over the state asking, I have this. Just the other day, I had an employer email me saying, at a grocery store, I have this kid who works for the grocery store, and he's talking about it all the time. I don't know what to do. and people are just not really sure how to start the conversation, whether to take them seriously. So I really just encourage you to reach out to people who are making an attempt to reach out and get help. So to give you a little bit of a scope of what this problem looks like from a public health perspective, at the national level, unfortunately, the numbers have been creeping up for the past few years, especially since 2008. And I think one of the major influential factors, and this has been covered a lot in media, has been the change in our economy. But again, it's not just one thing, but it certainly impacts people on various levels. And so probably by this point, this is our most recent data for the nation at 2011. It's going to be over 40,000 people this year. And when you think about the number of attempts times that, when you have it's H25 times 100 per day, it's just very scary because we don't hear about all of the people who are making attempts on their life. Some happen and people never know, they never tell anybody. And some, that don't need medical treatment, that is, and then others, we do capture that data through our data sources. So, and it's important to note that the majority of people, whether they've been diagnosed before their death or not, have been suffering from some type of mental health or substance abuse disorder, come to find out afterwards. So in Connecticut, we've been tracking data at the Suicide Advisory Board. We work very closely with colleagues at the University of Connecticut Health Center, as well as the University of Connecticut School of Social Work, as consultants who help us collect the epidemiological data that we use for our state planning efforts. We use a public health model, which is data-driven, so we really want to make sure that we're getting to where the problems are. And as you can see, like I said, since 2008, the numbers have been increasing a bit. What this doesn't show is that with our data from the Office of the Chief Medical Examiner, is that it hit a peak about 2 or 3 years ago, and it's on a decline, but it's may not be statistically significant at this point. So we're keeping a really close eye on that. And the numbers are starting to stabilize, which is good. So something we're doing is working. We're working really hard, like I said, to get these conversations going and to encourage people to reach out for help and to engage people who need help. So this is also the same Connecticut data that you were just looking at, but it's by gender and by age. So you can see there's actually been a shift because we historically the older populations were at increased risks, but we've been seeing since 2008 this uptick in the middle age population. So we've been concerned especially about reaching out to those populations and ways that we can get the messages out and resources to them. This is the data that we use for attempts in our state. It's the hospital data for self-inflicted injuries, so intentional injury. And as you can see, it looks a little different from the data I was just talking about. And we're here, you can see that it's the younger population that where the attempts are higher. And so when we're talking about prevention and intervention, and methods that work for that in terms of restricting access to lethal means and things. We know that looking at this data, we can also see what the methods are. And I'm sure you've been hearing a lot about opioid overdoses and prescription pill misuse and things like that. And for this population, that is extremely important that we get into the communities, and it's an opportunity for us that are working in suicide as well as substance abuse prevention to really engage with each other and to reduce the risk to our youth and other age folks who have access to substances like that. So I don't want to get too much into the risk factor and the warning signs, but I'm just going to post it up. I wanted to encourage you to sign up for the Question, Persuade, Refer training that the Southeastern Regional Action Council is going to be hosting soon. There's a registration form outside in the hallway on the table. And that training covers the risk factors as well as the warning signs and how to engage someone in help and to encourage that help-seeking behavior. And so on your way out, if you would just stop by there and sign up if you can, if you're available to do that. It's really important to be aware of the warning signs and risk factors so that you can kind of just be alert to your family and friends and coworkers, and and keep an eye on them and reach out to individuals who might be able to offer them help and engage them and connect them to those people. So as I mentioned earlier, in Connecticut, we've actually been active in suicide prevention since 1989. But we've had varying levels of success of coordinating these efforts through the years. And as you can see, there's been various groups involved. We had a youth mandate in legislation that there has to be a youth suicide advisory board, or at least an advisory board advising the commissioner of the Department of Children and Families around youth suicide. And there was also the development of an interagency suicide prevention network to address suicide across the lifespan and develop our first state plan. And then a few years ago, in late 2011, we decided to integrate those two groups through the collaboration that became the Suicide Advisory Board that you know today, the CTSAB. And we've been able to leverage a lot of financial and human resources as a result of that collaboration. And we have been fortunate enough to identify so many more partners than we ever were before. It's been truly amazing and rewarding working in this work in the past few years. We've also been able to apply for multiple federal grants and have been awarded those grants that have also helped us to address the problem in our state. So to the Suicide Advisory Board, we developed this mission together and our vision a few years ago when we became that group. And it's a combination of both state and state agencies, nonprofits, hospitals, survivors of attempts and of suicide death, and students, et cetera. And we just really felt very strongly that we wanted, even though we work on prevention, intervention, as well as response, that the prevention has to be in the forefront of all of that. And so our mission and vision are what you see here. And we're a network of the diverse advocates, which I mentioned, concerned with addressing the problem of suicide and promoting health and wellness. And we do believe that hope is essential in this work. Without hope, it would not exist. And you hear people talk about that quite often. And we have so many advocates and people involved in education across the state, and it's an amazing network, and it's ever growing. Every day we have people joining it. I have to update this actually, but these are some of the people and groups that are on the Suicide Advisory Board. And when you hear about a board, I would say it's honestly like more of a coalition. We used to be a board where you had just a couple of members. Our membership is over 220 at this point, and a few years ago, before, we had maybe 10 on one group and 40 on the other, but in essence at the meetings we maybe had 5 at each meeting. Sound familiar? And so when we joined, and a lot of them were the same people at both meetings, so when we joined them, we just found that the coalition work and the community organizing just took off, and as a result of the earned attention, I guess, because we've just been working really, really hard. We've had a lot of other people coming to the table and agencies coming to the table asking for help. Like, how do we address this problem in our work, in our workplace? And like right now, we've been working really closely with a lot of the hospitals that are interested in integrating some new evidence-based models and tools and different systems, Department of Corrections, the Connecticut National Guard. So we've been working really, really hard in different areas. We tried to start with what we call the low-hanging fruit, which we thought would be the easiest way to start, and have expanded these 4 priority areas in many, many ways. But the network that I just spoke about through our network of care. You can go to our state website, which I'll show you in a second, and just join the network. You don't have to attend meetings if you don't want to, but we always have some kind of professional presentation, or at least a, something that's engaging and thought-provoking for a topic. And we just had, for example, because it was National Suicide Prevention Month and Week, we just hosted a developer of a suicide assessment tool who came up from Columbia. And then next month, the chief medical examiner is coming, and we have often people doing the work coming and presenting on the kind of work that they do. So it's an open meeting. Anyone is welcome to come. You can join the network and just get our emails. We try not to inundate you with a ton of emails, but we do have all of our information on the website about the agendas and about the minutes, and any PowerPoint presentations that are shared are also posted in the minutes. So any past meetings that we've had for the past 2 years are all there, all of the PowerPoints and everything. So feel free to take a look at that. And we've been working very diligently on revising the state plan. It's hard because with working with so many people, it can, time sometimes passes and you're not always getting together, but the plan is in a final draft form at this point and is close to being released. We work very hard to make sure that the work that we are doing that's driven by that data I shared is evidence-based, and there are national registries that have different practices that we utilize, and really encourage the folks that we work with to utilize those practices. And then lastly, we had a couple of years ago this one-word campaign, which we engaged the Central Connecticut State University graphics arts students to develop. They spent about 2, maybe 3 semesters in 2011, early 12, developing this campaign that is in the hallway and that you've seen. And it was about 22 students and 1 advisor, and we just went back and forth with the advisory board, and they came up with this amazing idea. And it really seems to speak to a lot of people. We've had tables at national conferences, and we've had very positive response from other states, from campuses, from tribal groups. A lot at the national level, we work a lot also with tribes. And it seems to just, really connect with people. So we're very excited about it. And it's lasted the test of time, at least so far. So we just keep growing, having it grow. So I shared with you the video already. But what I'd like to share with you before I finish up is just the website. And just to let you know that you can, again, access the network here by, to join the listserv. You can add things to the calendar. If they're open events like tonight, you could add them to the calendar that we have that are related to suicide prevention and mental health promotion. Different resources for different populations. The materials page. You can order any of the materials you see on the table out there, free of charge. The United Way is our provider that manages the release of all of that. They have a magic closet that has all the materials in it. So anything you see out there and more is available.
But you can take some of it tonight if you'd like to, because I do have plenty here tonight. So if you'd like to take stacks of material with you tonight.
Yep. And then again, as I mentioned a moment ago, we have all of our information about the business side of our work, so our agendas and our minutes all on this page. So I encourage you, to go to the website, just investigate it, and my colleague Tim Marshall and I. Tim is from the Department of Children and Families. We are the 2 contacts. So if you have any feedback on the site, if you just want to share something with us, then feel free. Our contact information is right here, and I would encourage you to reach out to us, and we'd be happy to hear from you. Thank you.
All right. Thank you. Any comments? Any conversation as a result of that? Any questions about process, the website? What is the website again?
It's
PreventSuicide.org.
preventsuicidect.org.
Okay. I want to just mention we have a number of organizations in the audience from Ledgely Health District. You heard from Michelle Serac. We have representatives of the school district here tonight. Natchog Hospital is here. So it's a well-rounded group of professionals that are trying to surround this problem. So there's plenty of help that we can get. Our next speaker, John Holt. He's a sports anchor at WFSB Channel 3 and an Emmy Award winning sports anchor at that. Congratulations. Mr. Holt will give us a unique perspective on losing a family member as he lost a brother to suicide in 1999. John annually holds an ice cream fundraiser benefiting the American Foundation for Suicide Prevention at a New Britain Rock Cats game, and recently was awarded with the Regional Edward R. Morrow Award for his story, One Last Wish, which chronicled a home run hit by East Lyme native Johnny McDonald and current member of the Los Angeles Angels. Mr. Holt is a 94 graduate of Syracuse University and joined Channel 3 in 1999. Sir, welcome to East Lyme. Thank you.
Thank you. I appreciate that. In fact, it was just about a couple months before my brother's suicide where I started at Channel 3, and it seems like a whole different world ago, and how things are different for me and my family. I appreciate the opportunity to be here again as I was about a year and a half ago. Certainly appreciate the strength of the Dagle family, Ann and Paul, who have become friends of mine. I'm proud to say that. Ann in particular is a dynamo, small in stature, but an absolute dynamo on behalf of this cause in memory of her son. So, Ann and Paul, thank you for your strength. You continue to be an inspiration to me. Had an opportunity to share a few moments with Paul down near the water and the beautiful statue of Brian as a boy with a family pet, and I found that very moving. So I was glad I could make it down, and I hope that gives you strength as you drive by that in town, and others in town too that get to see that and may not even know the connection, but draw some happiness from that. My brother Lindsay was 25 in 1999, day after Thanksgiving, when he took his life, and I hope I don't offend anybody or offer too much reality, but what Andrea spoke about is real, and quite frankly, it should frighten all of us. Whether it's pressures from a sagging economy or military vets or those that have dealt with bullying, whether they be teenagers or young adults, there are a lot of people that are feeling lonely and feeling depressed. And my brother was one of those. He was 25, a college graduate. In fact, he was studying to get his degree, associate's degree, to be a nurse. Inherently a caring person. That was the career path he was hoping to take. I always point out that he was stronger and smarter and more handsome than his older brother, and all that's true. He appeared to have so much going for him, coming from what I perceived at the time to be a very typical upper middle class nuclear